Hey there, it's Lucas Catton with Innovia Life, and I've been having a lot of conversations recently with different stakeholders in the healthcare space. Anything from, individuals and employers to health plans and managed care organizations and lots of things in between. And it really comes back to ultimately we're all responsible for creating change in our system. And the one thing that that most people agree on is that costs are way out of control and that the results are poor in terms of the overall health and wellness of our country, United States. I'm sitting here on a rainy Monday evening in Atlanta, and it really is everybody's responsibility. So unfortunately, the system has been set up. Behavioral health and traditional health has been set up to reward ineffectiveness. Now, obviously, there's this push for value-based care and capitated risk plans and payment, models and things like that are making progress, and there's a lot of advancement there. And with that, I believe there you can go deeper, and that's where we're looking to fit into this place. And not looking to, that's where we know that we fit into this place, this space now is there is there's another level to all of this, and and that is the subclinical support level. And when you effectively include our services into population health management, and all parties are owning their own responsibility in this, then when providers take on risk, when payers, reward people for taking on risk, where people are motivated to change and improve their health instead of, immediately looking for a pharmaceutical solution or immediately getting a diagnosis and going into some type of clinical care, even if it's not warranted, or waiting until um, you develop a chronic condition because of poor health to do something about it. Like we all can be responsible here, and there continues to be a lot of finger pointing. Depending on who it is. Oh, it's the government's fault. It's the payer's fault. It's the provider's fault. It's the individual patient's fault. And it shouldn't be looked at as fault because fault is a blame and a negative thing. When what we can look at it for is we can look at it as a way of responsibility. It's all of our collective shared responsibility. If we want to change the system, we all need to be a part of that. And we're doing our part to be able to help reduce costs as much as 50 times ROI or higher, depending on the populations that we're serving. Um, and and how do you reduce costs while expanding services? How do we support people through the changing needs in life throughout ongoing living stressful situations because life can be stressful. How do we improve their ability to deal with stress and to take care of themselves and to build immunity and avoid chronic conditions and not slip back into old habits and patterns and routines that wind up requiring clinical interventions. Like how do we do that? Well, that's where we can come in and assist with that when there is agreement from the other angles as well, of engaging with people in a way that again improves their overall health with that. So we're saving money by reducing overall costs for all parties involved. um, Providers who are previously, unfortunately, those who are rewarded financially for the most costly services when people are sick and not doing well. Of course, they're not going to be as excited about this because it will drive down some of their revenue, those who are on those type of payment models. But now they would have an opportunity to look at capitated risk and owning some of that risk and responsibility in that. And there's plenty of examples of where people can get paid very well and do very well on the provider side by taking a look at the whole person's health. And how do we introduce more solutions in instead of immediately going to like GLP-1 drugs for losing weight, when maybe we can incorporate some contingency management stuff to where we're offering rewards for people who are owning their own responsibility for eating better, exercising, sleeping better, things like that. How can we coach them through that? How can we provide additional support for those that are going through it at the time? How can we provide additional guidance and things like that, education, etc. And again, this is where Innovia Life comes in, is that we can implement ourselves as part of that continuum of care, prevention, aftercare, in between as a complement to clinical services, and so much more for so many that aren't ever going to need some of those higher cost services. How do we step in and provide additional support for them to also improve their quality of life? So that's something that just wanted to share a few thoughts here as far as what we're seeing. Highly encouraged, despite all of the uncertainty that's happening on many different levels at the moment. What really is standing out is that things have to change. We're being forced to change in some way, and we have a way that this can work for everybody. So if you are an employer, or you are a payer, or provider, or an individual, if you're looking for solutions to improving overall health and wellness, helping people lead happier, healthier lives at reduced costs while expanding services, we need to talk, because I know that we can do that for you. Check us out, innoviabh.com. Hit me up personally, info@innoviabh.com. Again, this is Lucas Catton with Innovia Life, and I can't wait to talk with you. Thank you.